Hi, I'm Elizabeth Baird, a veterinarian at Country Oaks Animal Hospital in Palm Harbor, Florida. I'd like to speak to you today about leptospirosis. This is a bacterial infection that can affect dogs, other animals, and even humans. In fact, approximately 1 million people worldwide will contract leptospirosis, and of those, 60,000 will likely die from it. It is caused by the leptospira bacteria found in water and soil contaminated by the urine of infected animals. 40 years ago, this was considered to be a disease of rural dogs, particularly farm dogs, largely in the Midwest, muddy, wet pastures associated with cows and pigs. That is no longer true at all. This is now not only a suburban disease, it is an urban disease. Leptospirosis is now rampant in Manhattan. There have been outbreaks in Chicago. It has been identified in notoriously dry areas such as Arizona and Los Angeles. All dogs are considered to be at risk for leptospirosis, regardless of their geographic location, regardless of the environment. The ACVIM, a leading authority on veterinary internal medicine, now recommends vaccination for all dogs against this bacteria. In fact, the American Animal Hospital Association has also come out in support of this recommendation too. So how do they get exposed? Well, several species of animal carry this bacteria and can be infected by it. The raccoon, which is ubiquitous throughout the United States, rodents, which are everywhere. Here, citrus rats are common, wood rats are every place. Mice are prolific. Coyotes can carry this as well. The possum, which is everywhere. Deer, cows, pigs, and on the list goes. So typical scenario is pretty easy to imagine. Raccoons meandering through the yard or the park, foraging for food during the night. They stop, they pee, off they go their merry way. Okay. The next day, Fluffy's out for a walk with you and finds this fascinating scent and jams her nose into the wet grass or soil, and bingo, she has now been exposed to leptospirosis. Clinical symptoms of the disease typically appear in about 7 days. Now, they can range from very, very mild to very severe to fairly rapid death. Symptoms are fairly vague, okay? Fever and lethargy, loss of appetite, vomiting and diarrhea can occur. It does damage the kidneys, so if it gets to that stage, they will have an increase in water intake and an increase in urination. There is a form associated with pulmonary hemorrhage, so they may have problems with labored breathing. There are tests for this. It can be diagnosed through laboratory testing of blood and urine. Treatment is an appropriate antibiotic. Most dogs require hospitalization and IV fluids. The more severe cases, dialysis is required to save their kidneys. As you might guess, we are not able to save them all. Given the severity of this disease, clearly prevention is a better way to go than treatment. So in terms of prevention, number one is vaccination. Okay, we can immunize our dogs to protect them from this disease. The Leptospira vaccine is readily available. It is very safe and effective, and it's pretty easy peasy, 2 doses, 3 to 4 weeks apart, and then an annual booster. It's not particularly exotic, it's not particularly expensive. It's readily available. Your next option, of course, is whenever you're out on walks, try to avoid areas where there's stagnant water, puddles, creek beds, small ponds, that kind of thing. Rodent control is one approach. It's pretty challenging. You want to avoid the use of rat poison due to the potential for your own pets to get exposed directly or indirectly to the poison. If you elect to try that, I definitely recommend using a commercial rodent control service. Do be aware they are rarely 100% effective. As for yourself, you now know how to catch it. So gardeners, gloves, always, 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 always. If you have abrasions or cuts on your hand, you might want to think about putting off that gardening project till next weekend when your hand is healed up. Okay. In terms of your own pets and other people's pets, good normal hand hygiene. Wash your hands after handling other dogs, especially after cleaning up after a urinary accident. Okay. If you're not sure if your dog's immunizations are up to date, please check with your family vet. Make sure that their leptospirosis vaccine is current, and if not, seriously consider getting that updated as soon as possible. Quick note on vaccinations. So back in the day, this was considered a pretty hot vaccine, highly antigenic compared to some of the others. And we saw more vaccine reactions to it than we did to our other commonly used vaccines. So I'm not talking typically like acute anaphylactic shock and death. I'm talking the typical reaction was hives and a swollen face. Still no fun when it's your dog. So many veterinarians, feeling that our suburban dogs were low risk, did not use the vaccine. Unfortunately, that created a habit, and some still do not use the vaccine. Now, this is totally old information. It's ancient history. Given the technology and the amazing high-tech filtration that the manufacturers now use, the leptospirosis vaccine is considered very safe and very, very low reaction rate. In fact, there was one study that indicated that probably there's a higher risk of reaction to the rabies and distemper we use every day than the leptospirosis. So it is ancient history. Do not be discouraged or dissuaded from getting a leptospirosis vaccine because that information is no longer valid. Thank you so much for your time. I really appreciate you listening. I hope you and your pets remain happy and healthy. Bye-bye.